Let's speak now to the South African Medical Association Public Sector Advocacy Forum Chair, Dr. Akhtar Hussain, and Denosa Provincial chairperson in Gauteng, Simphiwe Gada. Mr. Gada, thank you so much for your time. The department says the issue of a shortage of bread at Baragwanath Hospital has been resolved. Your reaction?
Yes, I'm saying that we have noted the press break and apologies. Tomo. In the Eastern Cape as we speak. That's why the network is so much unstable. But we can confirm that we have taken note of what they are saying, but we are not yet satisfied. We will be convening organized labor as well as the Premier, because we do not think that this thing must be taken lightly, because it can't be that we even face a threat of running short of food in the hospital, because the hospitals are an environment that is important for medication to work. They need to get food. But what we think then that should happen is that the department has got to look at the root cause of the problem, and the Premier also has got to get the root cause, because the challenge we're having is that we have had a department that has been unstable administratively. And now, when we learned about these things, we were not, taken seriously. The challenges that we're facing now are as a result of this instability that has been there over the past, years at the Department of Health. So we will need a plan from the department. We can't just be told that the department is not in a crisis, and yet we see problems on the ground. So we need a comprehensive plan. We'll be calling for a financial meeting with the Department of Health, where they must show us the books and show us the allocated funds, especially for goods and services that affect the quality of patient care that is given to the patients.
I'll come back to you in just a moment, Mr. Gada. Dr. Hussain, I'm not sure if you can hear me on the line. I was listening to the CEO of the hospital quite earlier on, talking about how strained, the hospital is. I mean, you look at the fact that just a few years ago, they had around over 7,000 posts that were available, but now they say that some of those have become unfunded, and they're now left with around 6,200 odd. And she says that the staff complement is not aligned with the workload. This is a recipe for disaster.
100% you are right. It's not a disaster. It's the worst in this era, 2021 century. It never happened. Chris Hani Baragwanath Central Hospital is an academic hospital. It's the biggest hospital in Africa, whole southern hemisphere. And they have crisis. Shortage of doctors is not new. It has been last 30 years. They are not appointing enough people. If somebody resigns, they say zero vacancy. They take it out. In COVID-19, they employed temporary staff, health workers, nurses, and doctors. Now they don't want to continue because COVID is not finished. We are still having 8.5 or 9% of infection of COVID-19. And we are expecting there is a 5th and 6th wave, May and June. So now we're going to fire them and bring them back again. What happened? 13 to 1,400 healthcare workers died during COVID-19, 2020, 2021. Where are those posts? Why those posts are not filled? The issue is Baragwanath Hospital is nothing unique in whole South Africa. Every public sector hospital is limping, is in crisis. And if you look at the incompetency, financial management, corruption, I don't have to mention, it's in the newspaper everywhere. Supply chain is corruption. Incompetent managers, medical managers, CEO, HOD, they have no idea. If you're not performing well, they will transfer you to another hospital and bring another incompetent in that hospital. They are not well trained. MSC and HOD took 1 week to come and see Baragwanath Hospital whether they got bread or not. They were very happy the NGO and Gift of the Giver was supplying bread. It's never happened in South African history that hospital don't have a patient, don't have a food. Doctors are buying food from own money. Nurses are buying sugar and milk and bread for the patient. You cannot give medicine empty stomach to the patient. They have to have a food. and they were just silent. There were no crisis, no emergency. The HOD and many other senior management of the health department leadership was on leave, or they were not available. So this is a poor, totally poor management, incompetent. They need to be accountable. They need to be head roll on this. This is not, and it's not far. We have lost so many psychiatric patients recently. You know, I can give you the figure. At the moment, less than 0.7 per 1,000 patient doctor in that area. Less than not even one doctor equivalent to 1,000 patients. And psychiatry, 1.3 doctor per 100,000, not 10,000, per 100,000. So imagine how shortage is this. They are not even minimum critical post are filled. ICU, not enough doctor.
And Dr. Hussain, pardon me, I'll come back to you in just a moment. Simphiwe, listening to that, I mean, I cannot help but listen to the CEO of Bara this morning saying that they're carrying the load of Charlotte Maxeke, Helen Joseph, and you look at the fact that there's also a Bheki Mlangeni hospital not very far from where Bara is. Lilian Goy is right next to Bara. These budgetary constraints are going to also lead to more of a fatigue that we are seeing in healthcare professionals who are really strained by the pandemic, and even as we're hearing there from the South African Medical Association.
Yeah, and
it's more than saying that what we have just described is the situation that is currently happening. And what makes it more painful is the fact that when we cried about the issue of the Charlotte Maxeke Hospital, because the government has been quiet and not briefing us, and we did a follow-up. We spoke to the Premier, and we are being told that the people who are holding the progress of Charlotte Maxeke Hospital are business people around Charlotte Maxeke who want a share of what is happening. But at the same time, we are told that there was an over-quotation on the renovations that had to happen. So all these things, at the end of the day, they weigh heavily on nurses, doctors, everybody that works in the hospital. But, much as they weigh heavily on them, the biggest people who are affected by this thing are patients. You'll understand that the hospital has got a whole list of specialty services. You've got cancer patients who are taken care of there, who receive their treatment there. You've got special operations that have got to happen, which you cannot do in other parts of the province, but you need to do them at Charlotte Maxeke. So all these things require that the citizens of Gauteng together we can be able to hold the government accountable and be able to demand the answers. Because if there's only one voice of labor, it looks like we are only crying about the work environment, whereas we are not crying about the work environment, but it's about the broader services that have got to be accessed by patients in the whole of Gauteng. And by the way, that hospital also takes people from Northwest, the surrounding provinces, Mpumalanga and all. So we want to also take this opportunity and call upon the citizens of Gauteng to really work with us in calling for the immediate renovation of that hospital and opening of that hospital. We will be in this coming weekend. We'll be convening organized labor in the province and also convening other progressive formations who advocate for health, so that we can be able to go to the Premier, because as I've indicated, this is an issue that requires the attention of the head of government in the province, because the instability that is there in the Department of Health, the responsibility to have got to lay it squarely on the office of the Premier, because we did warn that you cannot have such a crucial department without appointments in key positions. I mean, the department doesn't have a CFO appointed, doesn't have a supply chain appointed. All you've got is people who are acting, and that has got to come to an end. We've got to understand that the instability of the department is what is resulting in all these challenges.
All right, I'll move on to you, Dr. Hussain, very briefly as a final question. We saw today the Gauteng Health Department saying that they also are facing their own budgetary constraints. constraints because their budget has also been cut by 50%. There's not really much of movement that it can do. This, of course, has a direct impact on the patient's experience when it comes to public health. How then does government begin to ensure that there's enough that goes towards the public health sector?
That's not very true. When you talk to the Treasury or you talk to the Health Minister, this is an emergency. Health is an emergency. Health is a responsibility of the government, Department of Health, and the President is as responsible of the country. So they must listen the cry of the patient or the citizen. That will tell you how bad, how poor is the health system. There are no budget restriction for the health worker. It's a corruption. It's a mismanagement, it's a poor strategic planning, it's a poor vision for the health, there's no leadership, the lack of leadership to run the health system in Department of Health is leading this crisis and suffering of the patient. Ultimately, patients is suffering. We, South African Medical Association, have been rising, we've been telling Department of Health from province to the national, all over the country.
All right.
The safety and security is another big crisis. We have lost nurses, we have lost doctors. Same Baragwanath Hospital, 2012 or somewhere, they have came right inside and killed our patient. The gang fight, things like that. There's no security system. So wherever you touch in Department of Health, you will find huge crisis.
All right.
It's just bread is not a main crisis now, and it's just a tip of the iceberg here.
All right, thank you so much to you both for your time. That was Dr. Akhtar Hussain. He's the South African Medical Association Public Sector Advocacy Forum Chair, and Simphiwe Gada, who is the Provincial Chairperson of Union Denosa in Gauteng.